Sure what happened with me and Corey last week. I sort of forgot. But anyway, this week we were to read chapter 15, which looked at solution focused brief therapy and motivational interviewing in the context of group counseling. And so I just want to quickly explore the principles application and their applications in group settings and how they can contribute to effective therapeutic outcomes. So, a little recap, solution-focused brief therapy was developed by De Shazar and Berg in the late 1800s, and it shifts the focus from analyzing problems to identifying and enhancing solutions. So the goal is to tap into client strengths and use brief interventions to promote meaningful change. So it operates under the assumption that clients have the knowledge and capacity to solve their problems. So the therapist's role is to facilitate change by focusing on the future rather than dwelling on the past. And the therapy is brief, practical, and goal oriented. So, several techniques are integral. The miracle question, which helps clients envision a future without their problem. Scaling questions assess progress and motivation. Exception questions identify times when the problem was absent. Compliments and encouragement reinforce positive behavior, and homework and experiments encourage real world applications of solutions. So, in a group context, it fosters a collaborative environment where participants support each other rather than in finding solutions. So the therapist facilitates discussions that highlight strengths and encourages practical interventions within the group setting. Motivational interviewing was developed to address ambivalence toward change, particularly in substance abuse treatment, and it combines elements of client centered therapy with directive techniques to enhance um, motivation for change. So, some of the core principles, it emphasizes a compassionate approach. Um, Therapists express empathy to build rapport, and then they develop discrepancy by highlighting the gap between current behaviors and desired goals. So they roll with resistance rather than confronting it directly and support self efficacy to reinforce the client's ability to change. So, MI techniques facilitate motivation and self reflection. Open ended questions encourage exploration. Reflective listening builds trust. And affirmations reinforce positive efforts. Summarizing helps clients process information, and uh, eliciting change talk encourages movement toward change. In group settings, MI helps members articulate their own motivations for change, so the group dynamic fosters mutual encouragement and allows individuals to explore resistance in a supportive environment. It's particularly effective in addiction recovery, health behavior change, and motivational enhancement programs. So, integrating SFBT and MI in group therapy creates a powerful framework for change. SFBT helps clients envision solutions, while MI enhances motivation to pursue those solutions. Both approaches emphasize client strengths, autonomy, and action oriented interventions. The way my brain works is I really need to see theoretical stuff applied. I don't know, there's probably a few of you out there who benefit from that as well. So I always try to create these examples just because it helps solidify concepts for me. So for you, hopefully too. So here in this example group, I am looking at, excuse me, a school counseling setting and how we could look at MI and SFBT SFBT group that might focus on students who struggle with academic motivation, very common issue. So the session could start with scaling questions where students rate their academic motivation on a scale of 1 to 10, and then this provides a self assessment baseline. Um, Then the miracle question could be used to help them visualize a scenario where they are academically successful. What would look different? Reflective listening plays a key role as students articulate the challenges and barriers they face. And then a breakout discussion can encourage students to share strategies that have worked for them in the past. The group setting, in this case, would foster a sense of accountability, and hearing solutions from peers may inspire students to take small, manageable steps. In this case, the counselor could reinforce positive efforts with affirmations and encourages students to set one specific achievable academic goal by the end of the session. Follow-ups in future sessions can track progress and refine strategies for maintaining motivation. So, an MI-SFBT group for adults dealing with anxiety and stress might begin with scaling questions where participants assess their current stress levels from 1 to 10. And again, this would allow for self reflection and tracking of progress over time. The therapist might then introduce exception questions, asking participants to recall a moment or moments when they successfully managed stress. And then this technique helps them recognize existing coping skills they may have overlooked. Open ended questions guide discussions about personal triggers and effective strategies used in the past. Reflective listening is key, allowing group members to feel heard and validated. In a structured problem solving exercise, participants could develop personalized stress reduction plans, choosing at least one strategy to implement before the next session. So, the facilitator could encourage commitment to these small, manageable, achievable goals and follows up in subsequent sessions to discuss progress and obstacles. And this approach fosters confidence, motivation, and a sense of shared experience among group members. Both SFBT and MI are effective in promoting change, but may not be ideal for clients requiring long term, in depth therapy. They work best with individuals who are motivated to engage in the process and are open to brief, focused interventions. So, in summary, SFBT and MI are valuable therapeutic approaches that emphasize solutions, strengths, and motivations for change. When used in group settings, they empower clients to support each other in achieving meaningful progress.